Hello everyone. How's your lockdown going on? Yesterday, I got to know, in fact, I read in the news today that one gentleman went out in the allowed time and at one police check post, he was asked that why you are out. He says, I am out to buy food from one of my favorite restaurants, which is a bit far away. Please hold your horses. This is not the time to pick and choose. Try to rely what you have in hand. I also went out yesterday to do some groceries, but I made a list and tried to do whatever I can grab in one go. So these are desperate times, so we have to take desperate measures. I was reading a bit historical perspective of social distancing. In medieval time, if someone used to suffer from leprosy, that person will carry a lepre bell, and the practice was that if he's coming towards the street or towards the gathering, he would start ringing that bell so that people get to know that a patient of a contagious disease is coming towards them and they would maintain social distance. So you can see this is nothing new. It has been practiced for hundreds of years. I think now we better change this name from social distancing to vaccines of social distancing. To discuss about more, I contacted my friend Dr. Sanjeev Sapkota, who is a public health practitioner at CDC, Georgia. We talked about a bit historical perspective, how it is being practiced, and what opportunities we can think of learning from this pandemic. Here it is, a conversation with Dr. Sanjeev Sapkota.
Good, right? Okay.
Yeah, good, good.
Okay.
Good morning. Good evening, Dr. Sanjeev. So,
I didn't have to say this.
so now I'm in conversation with a very good friend of mine. He is a public health specialist from USA, and we will again discuss some things regarding the this social distancing. Dr. Sanjeev, how are you, sir?
I'm good. Yeah, it's been a long time, and thank you, kind of thinking of me, and yeah, thank you for having me here, Dr. Said. It's been a long
So,
time.
would you like to introduce yourself, what you have been doing?
Right. Yeah. I mean, well, I'm a medical doctor by training, also public health expert and epidemiologist, and working for various public health agencies, and started out in health ministries in Nepal and Finland, and also WHO, World Health Organization, and been currently working for United States Federal Public Health Agency. I also am the chairperson of the health in the committee of the global, Nepali community, and I'm actually, kind of answering their questions as well, because there are many Nepalese out there in different parts of the country. So, yeah, I'm a medical epidemiologist, and this particular infection and the epidemics and pandemics are something I actually been working on for some time. I mean, in this decade, we have had like in three different epidemics, and I've actually directly or indirectly been involved with those. Yeah.
All right. So, Dr. Sanjeev, like
Right.
since the very beginning, people are talking about the social distancing, but still some of them they think it's not the most important thing. So, can you shed some light why it is the most important thing?
No, thank you. Thank you, Dr. Said. Well, the social distancing, the idea and the philosophy behind social distancing, everyone now know, is breaking the chain of the transmission of the virus. I mean, this particular virus and any other viruses cannot survive outside of the human body. I mean, even it does, it dies out, within, few hours to few days, depending upon where it lands. Okay. So the only way the virus goes out of the body of the infected person is by sneezing, coughing, and secretions from the body. It is not airborne as much as we know up until now, but still, new things have been emerging. But with the evidence we have now, it's not airborne as measles. So it comes out as a projectile in droplets and lands in various surfaces. I mean, if it is cardboard hard surfaces, it lasts longer. If it is soft surfaces, lasts short time. But it lands anywhere between 3 to 6 feet, and as far as can go to like 10 feet. So the idea of social distancing, I mean, you stay at least 6 feet away from infected person or the person you are suspect of, or any other person for that matter, is to kind of break the chain. So let the virus from the infected person not come to the healthy person. That's how we control that. That's the only way right now, prevention, public health, measure to kind of not the virus propagate and transmit. So all the measures that the government, individuals, communities are taking, like school closures, university closures, flight cancellations, and then country closures, lockdowns, all those, quarantine. The basic philosophy is, hey, let us break the chain of the viral transmission. So if we are strict and if we are very much in discipline and very much kind of adherent to these social distancing measures, then it will have a very positive outcome. I mean, believe me, like within 2 weeks, we're going to see impact of this social distancing. And then countries where they practice very strict social distancing, they're going to have, like good outcomes. Like China, I guess right now had like, longer before, but their social distancing measures were enforced by the government. So, we are seeing that. So yeah, so it depends on
All
social
right.
distancing.
In addition to that, has there been any remarkable improvement in production of vaccine?
Well, the vaccine production in general takes 3 to 6 months and up to a year. Okay, because there are several processes, as like kind of developing it, culturing it, testing it, marketing, all those kind of things are there. So I mean, in any general, any pandemic or I'm epidemic, once a new novel virus comes out, I mean, everyone. I mean, I've been known that it takes at least 6 months, and people are talking about well, some firms, some individual pockets, research should have kind of suggested that things are coming up as those vaccines. I mean, they have been producing, or some are going to come out sooner, but we have not had any authoritative information on that. So still, the virus, the vaccines are yet to come. The antivirals, there is no antiviral for this. We had an antiviral for influenza. I mean, but then no antiviral for now. But people are testing. I mean, people are testing in different hospitals and universities. They're saying they have had some good, encouraging results, saying that, hey, this antiviral works, that antiviral works. But for this particular disease infection, there is no vaccine right now, and there is no antiviral right now. But things are emerging. Products are coming out in the market saying that this may work, that may work. But from the official government and the WHO point of view, there has not been any medication or vaccine. So the only way that we kind of not get the disease is by preventing social isolation. If we get it, supportive treatment, like timely medical attention, timely, if we are in the vulnerable or at risk population, like the elderly, people with the underlying diseases, they need to seek medical attention right away. And
So,
yeah,
meaning to say, still the shining star is social distancing, right?
still a social
Uh,
distancing,
Now
preventing.
we know there have been so many epidemics in last decades.
Right.
So, have they practiced this as a major form of prevention in any other epidemic
Well,
or rather pandemic?
right. I mean, I would like to take you back, and all the viewers take back to almost 102 years ago, in 1918, when we have this first kind of documented pandemic. Well, there were pandemic influenza in the previous centuries as well, but then the first documented, people know, the great pandemic influenza of 1918, which supposedly killed almost like 5 million people worldwide. I mean, numbers are still debatable, but then in large number of people. So that was due to the influenza virus called H1N1 influenza, and nobody had immunity against that. So once the virus comes to the body, that then there was not adequate social distancing, not adequate public health measures, though some different cities and different countries kind of established and they practice, but in general, people were easily infected. So that actually killed a lot of people. I mean, 5 million. After that, in every 10 to 15 years, there was pandemic, like newer viruses came and pandemic occurred, but they were not as remarkable as the 1918 pandemic. But in 1958, 68, there were the other pandemics. Those killed few million people, and those were remarkable. But then in our like recent history, um, I can go back to like 1997 when they had this bird flu H5N1, very much isolated and confined to the bird population. They were saying that, hey, once this comes to the human population, it's going to be devastating because the H5N1 influenza had a very high mortality rate. But yeah, those were still, I mean, didn't come out. What we saw in this decade, I mean, in 2000, when the 21st century, we saw three major outbreaks and pandemic. Well, four. One was 2002 SARS, and then 2012 MERS, and both SARS and MERS actually are like severe respiratory diseases caused by the virus, and the virus was from the same family as this coronavirus is, the same family but different strains. So those three caused I mean, like caused a major mortality. But both SARS and the MERS were confined to like certain geographical area, and they didn't become like as pandemic as corona did. But both the corona is more infectious than MERS and SARS, but SARS and MERS are more virulent, meaning that they kill more. But the recent pandemic, I mean, beside this one, was back in 2009. It was called H1N1 pandemic influenza. So that actually got a designation of pandemic. That didn't kill. I mean, that did actually kill people, but I mean, along the same lines of any annual influenza does. Like, as you know, worldwide, annual the influenza that we get, like a severe form of cold that kills around 30,000 to 40,000 in the US and several millions around the world. And then that actually targets the vulnerable population, like elderlies, children, and all those kind of things. But this particular the H1N1 pandemic influenza that was back in 2009 and 10, that was not as remarkable as this one. Though it was pandemic, people talked about it, but then the media actually kind of said, "Hey, it was a hoax." People just made big deal out of it. So I just want to make a difference here. I mean, kind of point out here, the word pandemic does not mean severe or kind of life-threatening. The pandemic means it is infectious. Like come. I mean, there are three things that need to be fulfilled to be a pandemic. A, has to be a new virus coming from an animal to man, animal to human being. So that has to be a one criteria. Second, has to be sustained human to human transmission from one person to another. And third, has to be propagated and infecting people in multiple countries and multiple continents. So if this all criteria is met, from animal to human and human to human transmission and entire the global population, then it becomes pandemic. Doesn't mean that it is severe or life threatening. So 2009 and 2010 were much less severe than this one. But then that was more infectious. It was easily transmitted from person to person. So going back to your question, I'm taking a long time, but going back to the question. So in recent history, like I can relate like 4 or 5 pandemics, but with all the social media and all the new technology and new generation, and this is probably gonna be remaining in the people's memory for a long time, because this actually has gotten to this place up to now. I mean, we could have, not to say that we could have just said, hey, okay, something emerged in China, people kill, and then okay, don't close school, don't close airport. I mean, no lockdowns, and what would have happened? People will be infected, hospitals would be overwhelmed, and then as it did back in 1918, it would go to a certain phase, kill people, and go down. So I mean, right now, all the social distancing, all the the mitigations measures, things are gonna be very less than what it is naturally was going to do. So yeah, this definitely gonna be very kind of impactful, the what we are doing right now. I mean, I know it is unprecedented. I know people are frustrated. I know it has so many kind of unwanted impacts, psychological, mental, job losses, and social, all those are there. But if we consider life, I mean, as a primary thing, I mean, like a primary, and then we are saving lives at the cost of all of this. So given all
Right.
this consideration,
Okay.
this gonna
As a public health practitioner, what opportunities do you see in this pandemic to
well,
learn?
right. Well, I mean, the world is definitely going to be very cautious. People around the world are going to be very much, consideration. I mean, considering about the hygiene and health, and people are going to be, careful about, the health point of view, like, animal to human transmission. I think the hospital system, the public health system, going to be strengthened. I mean, there will be a lot of, the investment in public health system, in kind of kind of strengthening it from the, strengthening the laboratory system. As after any pandemic, after SARS, oh, okay, we should do something, people do that again. MERS came after MERS. In a pandemic, and H1N1 came. So I mean, like every time we have a big deal, in a big crisis, we're gonna, I mean, we're gonna, talk about it, and then there is gonna happen. But other effect, non-health effect, like, people are talking about, hey, environment getting cleaner, water getting cleaner, parks, like, all the human pollutions are getting lower. All those kind of things are there, and people are realizing the value of humanity, value of kindness, and, like, people not talking. I mean, the world is almost together, all in the same page now. Nothing that they are, it is transcending borders and transcending the cultural race, and everybody is talking about one human family, and then kind of trying to help them. So that's actually what matters most.
All right, Dr. Sanjeev, thank you so much for your time. So hopefully I'll take you on board soon.
Okay, thank you very much, Dr. Said. I mean, it was really good connecting with you, and yeah, thank you for this opportunity, and hopefully we'll be meeting with each other soon. Thank you.
Thank you. Thank you so much for listening, and thank you so much, Dr. Sanjeev, for sparing his time. Please keep on watching my channel, keep on subscribing. Hope to see you soon. Happy lockdown.